Hi and Assalamualaikum. My name is Nur Akila and I would like to give an intro about gastroesophageal reflux disease or Gerd. Gastroesophageal reflux disease or Gerd is the medical term for chronic acid reflux in the esophagus, which can happen when acid from stomach keep running back into the esophageal tube, then connect mouth and stomach. This acid reflux can irritate the lining of the esophagus, which momentarily caused by transient circumstance. However, Gerd is a persistent mechanical issue which indicates problems with the process that are meant to prevent acid from entering esophagus.
Assalamualaikum warahmatullahi wabarakatuh. For the second part, my name is Aisha Naila binti Hashim. I'm going to explain about how GERD happen or how GERD occur when there is problem with our lower esophageal sphincter, or we call as LES muscles. So actually GERD happen when this muscle that we call as LES is weak or relaxed when it should not that time, and that makes the stomach contents flow up into the esophagus. So actually our stomach has muscles that call these LES muscles at the bottom of the esophagus is open to let food from the bottom of the esophagus into the stomach, and it closed to keep food in the stomach. But GERD happened when it became opposite from this. So actually our stomach have a gastric acid that baked up our food pipe, or we call as esophagus. When this LES muscles or less esophagus sphincters does not close at all the way, the stomach contents can leak back into the esophagus. That makes this happen, or we call as gastroesophageal reflux. Like I said just now, when the muscle LES, the lower esophagus sphincter itself, it's relaxed too often or too long, the acid itself kind of backups into our esophagus. So that actually a ring of muscle fibers in our lower esophagus actually prevent swallow food from moving back up, but it became opposite because of this reflex that I said just now, because of this gastric acid. Okay, for the second part of my part, I'm going to state four common symptoms in the GERD. So the first commonly symptom is heartburn, or we call as acid indigestion or acid reflux. This heartburn actually is burning on our chest pain that start behind our breastbone and move up to our neck and throat. That make actually it can last long for 2 hours, and the GERD patient, and even feel worse after eating something. For a second common symptom is backwash, or we call as regurgitation. Okay, backwash, in this part, backwash actually is bringing swallow food up again to the mouth. So the food or liquid that we eat backwashing from our stomach into the throat after eating. That's why sometimes we can feel sore and we can feel like sore throat or sour taste in our throat. And some of the GERD patient can have trouble in swallowing food. The third symptom is nausea. We can actually is a acid overflow that make feel queasy or make you lose appetite. And although you eat like a while ago or 1 hour ago, you may feel like there's still more food to digest. And the fourth symptom is sore throat. Actually, the sore throat happen because if the acid rise into your throat and it made it sore. So it's like almost seem like bad wash that got the sour taste in your throat. So bad wash and sore throat has a almost same taste. And sore throat itself, it might feel like there's a lump in your throat, or like it's hard to swallow, like eating. And reflux into your throat often happens at night. So for four symptoms that I state, for these four common symptoms, it state that almost all the symptom has the same problem, that is hard to swallowing food. So it's kind of hard for GERD patient to eat or to drink something.
Hi, I am Sophia, and next I will explain the factors that cause rising of GERD. GERD is caused by frequent acid reflux or reflux of non-acidic content from the stomach. When you swallow a circular band of muscle around the bottom of your esophagus, lower esophageal sphinchter, relax to allow food and liquid to flow into your stomach. Then the sphincter closes again. If the sphincter does not relax as it should, or it weakens, stomach acid can flow back into your esophagus. This constant backwash of acid irritates the lining of your esophagus, often causing it to become inflamed. Here's an explanation of how each condition can increase the rates of gastroesophageal reflux disease. First, obesity. Excess weight, especially around the abdomen, can increase abdominal pressure. This pressure can push stomach contents upward, causing the lower esophageal sphincter, LES, the muscle that normally keeps stomach acid from refluxing into the esophagus, to relax more frequently. This relaxation can lead to acid reflux and increase the likelihood of developing GERD. Second, hiatal hernia. A hiatal hernia occurs when the upper part of the stomach bulges through the diaphragm into the chest cavity. This displacement can weaken the LES or alter its position, making it less effective in preventing acid reflux. Hiatal hernias are associated with an increased risk of GERD due to the altered anatomy and function of the LES. Third, pregnancy. During pregnancy, hormonal changes increase abdominal pressure from the growing uterus, and changes in the position of organs can contribute to GERD. These factors can weaken the LES and promote acid reflux, leading to symptoms like heartburn and regurgitation. Next, connective tissue disorders. Certain connective tissue disorders such as scleroderma or systemic sclerosis can affect the tissue and muscle in the esophagus and lower esophageal sphincter, leading to decreased motility or weakening of this structure. This impairment can result in difficulties with normal esophageal function, causing an increased risk of GERD. And lastly, delayed stomach emptying. Gastroparesis. Gastroparesis is a condition where the stomach takes longer than normal to empty its contents into the small intestine. When the stomach empties slowly, there's a higher chance of prolonged exposure of food and stomach acid in the stomach, which can increase the likelihood of acid reflux and GERD symptoms.
Now I will explain of factors that can aggravate acid reflux, exacerbating the symptom of GERD. First, smoking. Smoking weakens the lower esophagus sphincter (LES), the muscle that normally prevents stomach acid from flowing back into the esophagus. It also stimulates the production of stomach acid, increasing the likelihood of acid reflux. Additionally, smoking can reduce saliva production, which plays a role in neutralizing acid in the esophagus. Second, eating large meals or eating late at night. Consuming large meal or eating close to bedtime can increase pressure on the stomach and LES, promoting the fat flow of stomach content into the esophagus. Lying down after eating doesn't allow gravity to aid in digestion, making it easier for stomach acid to reflux into the esophagus. 3. Eating certain trigger foods. Certain foods such as fatty or fried foods, spicy dishes, citrus fruits, tomatoes, chocolate, onions, and peppermint can trigger relaxation of the LES or directly irritate the esophagus. This irritation can increase the likelihood of acid reflux in susceptible individuals. 4. Drinking certain beverages. Consuming beverages like alcohol, coffee, tea, carbonated drinks, and citrus juice can irritate the esophagus or relax the LES, contributing to acid reflux symptoms. Alcohol and caffeinated beverages can also increase stomach acid production, exacerbating the condition. 5. Taking certain medication. Some medications such as aspirin, non-steroidal anti-inflammatory drugs, certain muscle relaxant, and blood pressure medication can irritate the esophagus affect the functioning of the LES, leading to increased acid reflux symptoms in susceptible individuals.
Assalamualaikum and hi, I'm Najia. So I'm going to talk about how adopting lifestyle change could minimize the risk of getting GERD. First, dietary change. By this, you can avoid food that can trigger reflux disease such as coffee, alcohol, chocolate, peppermint, carbonated drinks, and spicy food. Next, by changing eating habits can help to reduce reflux disease, such as avoid taking late evening meals and take a food that contains a lot of fiber, where it can make you feel full instead of overeating, which can cause reflux disease. Instead of taking a healthy food, where it can help to reduce the risk, such as take a food by following the food pyramids and schedule your eating pattern effectively. The next one is weight loss. Weight loss in obese patients will presumably reduce the increased pressure on the gastroesophageal junction, reducing reflux. In this case, it helps to ease some pressure on our stomach. For an example, stomach contents can give a pressure and force to back up to the esophagus. The last one is smoking habit. Smoking will damage the lower esophageal sphincter pressure and production of salivary bicarbonate. Lower esophageal sphincter (LES) function is to let food pass into a stomach. However, when it comes to a smoker, muscle spasm will present inside the esophagus where it is an abnormal LES. It loses its shape and its strength, where it allows acid to flow outward. Salivary bicarbonate, used to neutralize the pH inside the mouth, smokers tend to drain their salivary glands and will make the food become acidic because the saliva are not working as a buffer.
So, here we can conclude that gastroesophageal reflux disease or GERD is a complex digestive disorder which characterized by the frequent backflow of stomach acid into the esophagus, which leading to discomfort and potential complication. But by managing a multifaceted approach that includes identifying risk factor, adopting lifestyle change, adhering to treatment plans, and seeking medical guidance to mitigate symptoms and prevent long-term complications associated with the condition, it really can help us to prevent from the disease.